Health officials are tracking a new variant of the coronavirus. It's been found in at least 3 states so far.
And cases are starting to pop up around the world. The new strain of the virus has been detected now in several countries: the UK, Denmark, South Africa, Portugal, and Israel. That's according to the Global Initiative on Sharing All Influenza Data. For more analysis, we want to go to Dr. Owais Durrani. He's an emergency medicine physician in Houston, Texas. Thank you so much for being with us. We really appreciate it. I have been in Los Angeles, and while we don't know that it is confirmed that it is BA.2.86, I can tell you there are like 9 to 10 people in my office there alone who have all of a sudden gotten this. Can you tell us more about this variant, how it's different from other strains? It seems very contagious.
Yeah, absolutely. Thanks for having me this morning. Look, we've kind of all gone through virology over the last few years, and we know these viruses mutate and we get variants. How this is different and why it's kind of raising a little more alarms is, usually from variant to variant, you might have a few mutations. This one has 36 different mutations.
Oh, wow.
Now, it's not unheard of. Like when you look at the original COVID strain and like Delta and others, we did have times where we had more than 36, but since then we've had kind of more incremental change. So that's why it's a little more kind of on the radar. Anytime we have a new variant, we ask 3 questions. Is it more transmissible? Does it make us sicker? And do the vaccines and therapeutics we have against it work? Right now, those studies are being conducted. So this first hit our radar kind of early August. We should have the answers to most of those questions either kind of mid this week or next week. But for now, in the meantime, I urge all people that are high risk or maybe concerned or just don't want to get sick, mask up and try to brush up on some of the things we've learned over the last 3 years.
Jamie and I were talking that I, too, had a family member who also got COVID recently, who never got it this entire time. This is the first time for him. And we wondered if this variant was if people who had never gotten COVID before, even though he's been vaccinated, were particularly susceptible to it.
Absolutely. That's a possibility. Kind of where these mutations are at are around those spike proteins that kind of increase the virus's ability to kind of attack your immune system and kind of get you sick. So those that may have been vaccinated and it's been over 6 months, they might be kind of, getting it for the first time. Also, if you've had COVID before, a lot of times with these newer variants, we're immune against those because we were infected before. This one, it looks like might not be as protective, previous infections and vaccinations against this one, but we should have those definitive answers here pretty soon.
We always have so many questions when these variants pop up, right? But one thing I've heard a lot of people talking about, just because it has been a big topic of conversation in my area, are the updated vaccines. I know they're supposed to roll out next month, but are they going to protect us against this new variant? From everything I'm reading, it's about Omicron and some of the past variants. So how will this work?
Yeah, so this variant's a new one, right? So they didn't create the vaccine for this variant in particular. What they did was, just like the flu vaccine, we look at Australia, they're a couple months ahead of us, and we kind of predict what's going to come to the US. So kind of a few months ago, they looked at what variants were kind of emerging, and at that time it was XBB.1.5, and that's kind of the one they targeted. Now, obviously, this is kind of a newer development, so they are testing the vaccines against this variant to see, what those results are going to be. And I imagine if it's, something that's a total surprise, they may kind of modify that release that's expected in mid to late September.
So I got to tell you, when I heard about this and heard about the possibility of another booster shot, I'm one of those people a little bit suffering from like booster fatigue.
I'm suffering from all COVID fatigue.
Right, and it was, and plus, last year was so much easier here at CBS. We have like a clinic. We could just go and get, whatever shots we needed. They made it so much easier. Now it's a lot tougher to get your hands on tests. They're more expensive. Yep. Masks, and certainly to get a vaccine, you might have to make an appointment to get a booster shot. So is there a possibility that we're looking at a comeback when it comes to, some of the precautions that we took before? And are you concerned about people just not really willing to do that anymore?
Yeah, so I don't want to scare people. We're not going to get to like lockdown territory or anything like that at any point during this kind of pandemic or because of COVID. So that's off the table. What is on the table is that we have a lot of tools. Some tools are, cheap and easy to use, like putting a mask on if you're getting on a plane. Some tools are kind of a little more burdensome, right? Isolating, making sure that you're getting tested, things of that nature. And so depending on how bad these waves are and how much COVID is in your community, you may have to use fewer tools or more tools. I like to tell my patients we were super prepared 2 years ago. We all had tons of tests and tons of masks. And like you're saying, those things are not as easy to get. A lot of times they're not going to be free or cheap to get. Your insurance may cover only a certain amount of it. So now is the time to prepare to see, A, do you have tests at home? Are they expired? If they are, they're not going to work as well. So make sure you have up-to-date tests. Make sure you have some N95 masks at home for all family members, numerous ones. And then make sure that when we do get that final evidence-based guidance from the CDC on these vaccines, to get them when you are qualified. And then also making sure that, just like last winter, there was a lot of flu, a lot of RSV. We have vaccines for both of those things. And so making sure that you get those vaccines as well.
I'm just glad we're talking about this because I recently flew from LA to here and I did wear a mask, but no one else on the flight was wearing one. And just knowing what was going on in our particular area, I wanted to not only protect other people, but
you don't want to get it.
I don't want to get it either coming into New York. So I think it's important to have these conversations and kind of rethink about it. The other thing was my mask. I had 2 of them break because they've been sitting for a very long time. So just replacing, I think this is all really good advice and things for people to think about.
Yeah.
Dr. Owais Durrani, thank you so much for being with us. Appreciate it.
Thanks for having me.